Hi, I'm Paul Grand, CEO at MedTech Innovator, and welcome to our Best Video competition. Today, you are going to have a chance to select the winner of a $10,000 prize for Best Video. In this part of our program, each of the companies at MedTech Innovator makes a video that's approximately 1 minute in length. We do this because we want to give the companies a tool they can use to talk about their story in a very short and compelling format. And video is definitely the best for that. Each year, our companies report to us afterwards that this asset is one of the strongest things that they've done as a company. It's a great promotional opportunity, it's a great team building exercise, and ultimately, telling your story in 1 minute is truly an art. With that as background, let me introduce you to the 5 companies that are going to be competing today for the best video. They include Mowoot, Leaf Therapeutics, Cerebra Health, Oxense, and Adar Health. So how do we choose the 5 finalists? It came down to 4 criteria. Number 1, quality of the video. It had to be a high quality video. Number 2, marketing and promotion. If you've got a great video and no one sees it, does it really matter? Number 3, the vote of our selection committee. They had an opportunity to weigh in and tell us which of the videos they liked. These are the selection committee made up of our corporate partners. And finally, length of the video. This is a 1 minute video competition, and the closer to 1 minute, the better. So here's how this is going to work. You're going to sit back now, you're going to watch 5 terrific videos, and then after the videos, we'll provide a link for you to vote by email for the winner.
First up, Cerebra Health.
Our sleep underpins who we are. Your likelihood of developing cancer, how stiff your joints are, psychological and psychiatric conditions.
So the traditional sleep scoring methodologies, which are the standard of care, don't capture the true depth of sleep.
The big change that we bring is in the analysis of EEG.
The holy grail of sleep research is a metric of sleep depth. That's the holy grail.
We've taken the process of collecting EEG out of the sleep lab and into the patient's home today.
That's a major move forward in medicine and healthcare.
We give them a window to understand their own sleep in real time, because when you change a person's sleep, you change their life.
Adar Health.
Every single one of you watching knows someone with a chronic condition. I'm one of you struggling to manage my mom's condition. She's not alone. More than half of US population have at least one chronic condition that require regular monitoring of health, especially people with COPD, which is the 3rd leading cause of death in the US, contributing to over $50 billion in annual cost. Today, there are no single device or system available to predict or prevent COPD-related exacerbations. Now imagine if we could predict it weeks before they happen and help clinicians intervene early. That's why we created MouthLab, a non-invasive, at-home, rapid health assessment device that measures more than 10 vital health parameters in just 30 seconds. Our predictive analytics engine combines this trend data into one composite index, which can detect the gradual worsening of COPD and send proactive alerts in real time when it crosses a clinician set threshold. In most cases, this happens weeks in advance, giving physicians the time to adjust treatment, improve the patient outcomes, and turn reactive treatment into proactive care. At Adar, our mission is to empower patients with chronic condition and improve their quality of life. Please join us in our pursuit to change the culture of healthcare monitoring.
Oxense.
Hundreds of millions of people are infected in the hospital each year, killing 50% of patients in intensive care units, especially in developing countries. Even if the patients survive, they suffer from these infections with longer hospitalization. I am Asiye Karakulukçu, and I saw this problem every day in my work as a clinical microbiologist. With my co-founder Mürsel, who is a chemist, we started to look at ways of reducing this problem. What Mürsel and I have done is develop a rapid blood analysis method to identify hospital-acquired infections before it kills the patients. The Oxen sensor is a bedside device that can diagnose infections based on 7 different bacteria that are responsible for the majority of hospital-acquired infections. We have completed successful clinical trials with 400 patients in intensive care units and are now validating our diagnostic. By catching infections early, we save lives, we save money, and we free doctors to spend their time healing rather than firefighting.
Mowoot.
Chronic constipation is still one of the biggest unmet needs in gastroenterology, with a huge impact on the patient's quality of life and high costs to the healthcare systems. Conventional approaches are either pharmacological or invasive and leave the patients unsatisfied due to their side effects and lack of performance. We at Mowoot have developed a purely physical, non-drug and non-invasive solution in collaboration with a leading European neuro rehabilitation hospital. Our patented technology uses air to gently and wave-like apply pressure to the large intestine and hence move the feces and stimulate their hydration, resulting in natural and healthy bowel movements.
The treatment feels comfortable and reproduces very closely the professional abdominal massage of physiotherapists.
Join the movement against chronic constipation.
Leaf Therapeutics.
Mental health care is broken. 50 million Americans have anxiety or depression, but 2 out of 3 receive no treatment, costing human lives and hundreds of billions of dollars. There aren't enough mental health providers in the country to treat the scale of the problem, and with no objective biomarkers for mental health, it's hard to know who needs help. That's why Leaf pioneered a breakthrough smart patch that can track and improve a key biomarker of mental health. For many of us, it's hard to know when a thought or challenging situation could prompt a cycle of anxiety or depression. Leaf's patented biometric algorithms detect when the patient is most at risk, then automatically guides their breathing at a discrete, evidence-based intervention called heart rate variability biofeedback. Through targeted interventions throughout the day, Leaf can bend the behavioral health curve for patients gradually towards reduced mental health symptoms and greater physiological control. The Leaf device and mobile app connect to a network of more than 3,000 licensed mental health providers around the country, providing a robust telebehavioral health solution covered by most insurance plans.
Doing mundane tasks, I can kind of breathe and relax myself into a state of calm.
For patients with mental health challenges, it can often feel like there are no good options. But with Leaf Therapeutics, belief may be just a few breaths away.
Now it's in your hands. Open up your email and you'll find a special email from SurveyMonkey sent by the conference. This will have a special unique link for you to vote. All you have to do is click the name of the company. That will take you to SurveyMonkey, hit submit, and you're done. That's it. Please make sure that you don't forward that to other people because that link is just for you. No one else can use that. So it's a unique link for each voter. As soon as you're done, you should get a confirmation email telling you that you voted for the company. After you voted, I encourage you to do 2 things. Number 1, go to our website at medtechinnovator.org, click on the US program tab, and choose the best video competition to watch all 62 of the companies that provided their videos. Number 2, come back here on October 6th at 10:30 Eastern for the MedTech Innovator Finals. During that competition, we will announce the $10,000 winner of the best video competition. Thanks for being part of this. It's always up to you to choose the winner, and we love having your engagement and your participation.